Do you have places that hold water around your house? Maybe things like tire ruts or potted plants or even a bird bath. And mosquitoes, they breed in places like that. That's where they lay their larvae. Did you know that that one female mosquito can lay up to 300 eggs in just a small amount of water? Even a catfill can hold up to 300 different larvae. Did you know that that same mosquito can carry up to 10 different diseases? Some deadly ones too, even like Zika, malaria, and the West Nile virus. You're gonna need to protect yourself. Things that are around there every day can kill you. You need to be careful. Invest in some bug spray, quality bug spray, protect yourself and protect others. These diseases can spread rapidly.
So as Max mentioned, there are many different types of diseases that mosquitoes can transmit, but today we're going to talk about 5 of them. The first one that we're going to talk about is Zika virus. It is transmitted through mosquito bites, pregnant women, and through blood transfusions. Some symptoms of it are fever, rash, headache, joint pain, red eyes, and muscle pain, and these can last for several days to weeks. Normally you don't get sick from it, but sick enough to go to the hospital, but people rarely die from it. So some ways you can prevent it is wear long sleeve shirts and long pants, and insect repellent if you go outside also. If you stay at your house, make sure you're in an air conditioned area and your windows and doors have screens on them. And for children under 2 months, make sure you use like a mosquito net. And if you have to sleep outside, sleep in a mosquito net or in like a tent or something like that. And there is no like vaccine for it, so if you get it, you basically just have to get over it. Another one of the diseases that can be transmitted by mosquitoes that is deadly would be the West Nile virus. The West Nile virus is the leading cause of mosquito-borne diseases in the United States. It's most commonly spread to people by the bite of an infected mosquito. So, like, to prevent this, you want to use insect repellent or mosquito net if you go outside for long periods of time. Babies and children, like, cover their arms and legs with long clothing. Mosquito netting if they're in strollers. Always follow instructions on products like your mosquito repellent, because DEET can be poisonous if too much or eaten or drank. Make sure you wear long clothing and stay in air-conditioned environments if you can. Treatment, there's not really treatment out there, but over-the-counter pain relievers can be used to reduce symptoms. Severe cases, patients need to be hospitalized, and if you think someone might have it in your family, talk with your healthcare provider. And some symptoms, 8 out of 10 people mostly don't get symptoms for this. So another one of the diseases that can be transmitted by mosquitoes is malaria. Malaria is a serious and could be fatal disease that is transmitted by being bit by a female mosquito. Like I said, it's transmitted by being bit by a female mosquito. Malaria cannot be transmitted from person to person like the cold or flu, but it only can be transmitted by a mosquito. Anyone can get malaria. Most cases occur in countries where the mosquitoes infected are most likely to be. So like Africa and like the south of the Sahara Desert. The symptoms include fever, flu-like illnesses, including shaking and chills, headache, muscle aches, and tiredness. Nausea, vomiting, and diarrhea also may occur. So, if you feel sick, you most likely have been bitten, Most people feel symptoms between 10 days to 4 weeks after infection, although some people may feel ill as early as 7 days or up to a year later in some cases. Most people who have the disease will have fever, sweats, and chills, vomiting. It can become very rapidly severe and life-threatening. So talk to your healthcare provider or doctor if you feel you might have it. How can you prevent getting it during travel? There is a medicine that you can take before you go to a place that has been infected with the disease. You would want to talk to your healthcare provider to get the medicine 4 to 6 weeks before you travel, so that the medicine can take effect. And long-term effects, there's not really any long-term effects other than it can be used to prevent malaria, and it is shown to be safe on most people. So the fourth one that we're going to be talking about today is dengue virus. Dengue virus is spread through an infected female mosquito bite. It is commonly found in more than 100 countries around the world. 3 billion people live in at-risk areas. And as of the time of recording this video, the Caribbean is one of the most highly infected areas. So some key facts about it are only about 1 in 4 people that get infected will feel sick. And symptoms can be mild or severe. If you get severe symptoms, they can become very life-threatening within a few hours, and you want to seek hospital attention. So some symptoms of it are nausea, vomiting, rash, aches and pains, and normally if you get it, you'll be over it within a week, and your symptoms will normally last about 2 to 7 days. There's not really a treatment for it, but you do not want to take aspirin or ibuprofen. You want to rest as much as possible and drink plenty of fluids. So the last disease that we're talking about that can be transmitted by mosquitoes today is yellow fever. Yellow fever is commonly found in tropical and subtropical areas in Africa and South America. It is spread by a bite from an infected mosquito, and it is very rare illness in U.S. travelers. Some symptoms are sudden fever, chills, severe headaches, back pain, body aches, nausea, vomiting, fatigue, weakness. And if you have very, very severe weaknesses, you can have yellow skin, shock, or organ failure. Some treatment for it, there's not really any treatment, but you should drink plenty of fluids, rest, use pain relievers and medication, but avoid aspirin or other things like that, because it can increase risk of bleeding. And the majority of people infected will sometimes not have any symptoms, and if you develop symptoms, the time of infection to illness is normally about 3 to 6 days.
So now that you know hundreds of thousands of mosquito larvae could be in small areas like this, are you going to be observant? Look out for small areas like this around the house and flip over containers. And keep in mind that diseases like the West Nile virus have no vaccine.